Answer from British K. Touch, Doctor of Medicine. A new virus called the Severe Acute Respiratory Syndrome virus Corona 2 (SARS-CoV-2) has been discovered as a cause of an outbreak of one of the diseases that began in China in 2019. The resulting disease is called coronavirus 2019 (COVID-19). In March 2020, the World Health Organization (WHO) announced that it had classified 19 as a pandemic. Public health groups, such as the Centers for Disease Control and Prevention in the United States (CDC) and the World Health Organization (WHO), are monitoring the pandemic and posting updates on their websites. These groups have also made recommendations about disease prevention and treatment. How does COVID spread 19? The data showed that it is spread from person to person through close contact, within 6 feet, or 2 meters. The virus is spread by respiratory droplets released when the infected person coughs, sneezes or talks. What are the symptoms of COVID-19? Symptoms of COVID-19 can range from very mild to severe. Some people have no symptoms. Mild symptoms may include fever, fatigue, cough, sore throat, headache, and a weak sense of smell or taste. There are more severe symptoms, which may include shortness of breath, chest pain, and severe vomiting and diarrhea. Symptoms may appear between 2 and 14 days after exposure to the virus. Can COVID-19 be prevented or treated? There is currently no COVID-19 vaccine available. There are no recommendations for specific antiviral drugs that can be used to treat COVID-19. The treatment approach focuses on relieving symptoms. What can I do to avoid getting sick? The United States Centers for Disease Control and Prevention (CDC) recommends taking the following precautions to prevent COVID-19. Avoid attending large events and gatherings. Wear a cloth muzzle in public places. Avoid close contact, within 6 feet or 2 meters, with anyone outside your home. Wash your hands frequently with soap and water for at least 20 seconds, or use a hand sanitizer that contains at least 60% alcohol. Cover your mouth and nose with your elbow or a tissue when you cough or sneeze. Dispose of the napkin after using it. Avoid touching your eyes, nose and mouth. Clean and disinfect daily the surfaces you frequently touch. If you have a chronic disease condition and you are at a greater risk of developing an acute illness, consult your doctor about additional ways to protect yourself. Should I wear a protective mask? The Centers for Disease Control and Prevention (CDC) in the United States recommends wearing face coverings in public places, such as grocery stores, where it is difficult to avoid close contact with others. This recommendation is of increasing importance in areas experiencing a local outbreak of the disease. This updated recommendation is based on data that people with COVID-19 can transmit the virus before they realize they are infected. Use of masks in public places may help reduce the spread of infection by people without symptoms. General people are advised to wear non-medical cloth masks. As for surgical masks and N95 masks, the health sector suffers from a shortage, and therefore should be used only by healthcare providers. Can I travel? If you plan to travel, first check the official travel warnings. It is also best to consult your doctor if you have health conditions that make you more likely to develop respiratory infections and its complications. What can I do if I get infected or suspect that I have COVID-19? If you have symptoms of COVID-19 and you have been exposed to the virus, contact your doctor for medical advice. If you need to go to the doctor or hospital, contact beforehand so that healthcare providers can take steps to make sure others are not infected. Take the following precautions to avoid spreading the disease. Stay at home and do not go to work, school, university, or public areas, except for the purpose of obtaining medical care. Avoid using public transportation if possible. Wear a muzzle while you are around others. Isolate yourself as much as possible from others in your home. Use a separate bedroom and bathroom if possible. Avoid sharing dishes, drinking glasses, bedding, and other household items. Subscribe to my channel to receive all new thumbs up.